and howdy from San Antonio, Texas. We're very happy y'all have joined us this morning for the live webinar titled Rodent Surgery, Aseptic Technique Made Easy. I'm Mitchell Moore of the University of Texas, San Antonio, and I'll be moderating this session. Today's educational seminar is presented by LabRoots, the leading scientific social networking website and provider of virtual events and webinars advancing scientific collaboration and learning. To learn more, please visit www.labroots.com. You can pose questions to the speaker during the presentation while they're fresh in your mind. To do so, simply type them into the QA box, which will open when you click on the green Q&A box at the lower left of the presentation window. Questions will be answered after the presentation. Did everybody see the Q&A box? Good. To enlarge the slide window, click on the screen icon in the lower right-hand corner of the slide window. If you experience technical problems seeing or hearing during the presentation, just click on the support button found at the top right of the presentation window, or report your problem by clicking on the green Q&A button at the lower left. This is an educational webinar and thus offers free continuing education credits. After the webinar is over, please click on the CE button located at the bottom left-hand corner of your web page and follow the process of obtaining your credits. I now present today's speaker, Dr. Marcel Perret-Gentil of the University of Texas at San Antonio.
Thank you, Mitch, for the introduction. Ladies and gentlemen, welcome from San Antonio, Texas. And wherever you may be in the world, we are pleased that you decided to attend this session. I hope it's to your pleasing, and I think it will be a treat to you because we have a number of slides and videos that we believe will be helpful to you. Thank you very much for attending. So I get this email from, let me call him investigator Professor Jones, do not say the name. And it's an email that I have received more than once before. My animals are dying, and I think the animal facility is the problem. So I say, okay, Dr. Jones, why don't we just meet in the animal holding room where you're actually the rats are having the problem. These are surgery animals that have been dying as of recently in the last 3 months. Strange that I just found out now. Well, we get into the room, and I am used to this because it has happened more than once where the investigator definitely will blame the veterinarian. Who else is he going to blame? And I said, okay, well, it's okay. Why don't we just look at the circumstances and see what the problem is? We need to get to the bottom of it. You need to do your research, and we need to have good care of the animals. So we have our discussion, we end the discussion, and I eventually went and asked him, I want to see how you're doing the surgeries. Well, I go to watch the surgeries in his lab, and I was horrified of what I saw. I mean, it's to a certain extent what I expected. First, I see that the animals are being clipped, the hair is clipped on the animals, and they're using a number 10 blade instead of a number 40 blade. Well, a number 40 blade shaves the animal down to the skin, a number 10 blade leaves a lot of hair in place. Then they do a scrub of the animal that was inadequate with betadine solution. We'll get into this in a few minutes. I see that the investigator has autoclaved the instruments, but when they place the instruments on the table, they put them on non-sterile surfaces. So right there we have cross-contamination. There is no surgical drape, no sterile gloves. There are no sterile gloves to be found anywhere in the EI's lab, in the investigator's lab. There is all kinds of cross-contamination. The individual doing the surgeries kept adjusting her glasses and the mask on her face and this and that and the other. So I say, I think we have a real problem. Well, this individual eventually, because we have to report these things to our institutional animal care and use committee, and he wants to defend his program, and he brings data. And he indicates and shows that only 5% of many rats that he has done surgery with have succumbed, have died. So he's using that 5% survival as indication of his success. So let's do a poll, and Tracy's going to help us push the polls. I have several questions. We're going to answer them all, and we'll go over this poll. So please answer each question quickly. Thank you for answering them. This is your last question. Okay, we can look at the results of the poll. I'll talk about them. So do you perform survival surgery in rodents? We have a 72% response. Great, a lot of people do survival surgery in rodents. Okay, let's look at the next question. If you perform survival surgery in rodents, are you very confident that you follow strict aseptic technique? Okay, 73% has answered yes. Okay, good, thank you. Do you conduct rodent surgery training or are responsible for such training at your institution? So we have a 63% yes. And the next question and last question is, if so, how well do your investigators apply strict aseptic technique? About 21% perform very well. Can we go back on the last? Okay, about 23% very well, 46% well, and you can see pretty bad, 6%. And well, I kind of expected these results because if you think about it, these investigators, most investigators that do surgery in their labs and animal facilities, they have not had adequate training as I expect. Okay, so the last question is, would you like to find easy and practical ways to be able to conduct or teach strict aseptic rodent surgery in rodents? Very good. Thank you very much for answering these questions. So after this meeting with this investigator, I became very frustrated because we do have a rodent surgery, survival surgery training program at our institution. This investigator and the entire staff in his lab have gone through the same training that everybody else goes through. And I said, what's wrong? How come we're not applying these things? We went through aseptic rodent surgery. What do we do? What did we do wrong? So I said, things are going to have to change. I have for years looked in the internet, and I have looked for materials that help me illustrate aseptic technique in rodents and an easy way to do it. And again, frustrated with my findings. So today, our objectives will be to identify and easily correct common mistakes that lead to breaks in rodent surgery aseptic technique. By the way, this is not going to be a presentation full of stats, graphs, statistics, a lot of scientific data. This is a presentation in which we're going to present to you, we're going to give you materials that you can use for your investigators and for yourself to apply good technique. We're going to explain practical uses of press seal as a draping material, which is a grocery item, but it is packaged sterile, and we'll go over that in a future slide. Always remember that because it has a sticky side, the press seal should be placed towards the surface intended to be draped. And we will go over practical uses of sterilized aluminum foil as well. So this presentation, we're going to show a number of slides where the good will be indicated by this little saint or smiley face, and things that are done wrong by this little guy called the devil. So first of all, let's define aseptic surgery. Not quite define it, but talk about why aseptic rodent surgery. You have all heard it, because I've heard it repeatedly, that rodents don't get infected, or if they get infected, it's no big deal. And so let's talk about it a little bit. So survival alone is not a valid criterion. Remember this investigator, Jones, that said that 5% of his rats, only 5% mortality rate in his research. Well, he was using survival as a criteria for success. However, success should be based not just on survival, but on the absence of altered physiological functions, immune responses, and behavioral changes, which he had not measured. So aseptic technique increases the success of ovarian transplants in mice and speed the return to post-op state. Also, when there's contamination in the surgical field, an animal becomes contaminated in surgery, macrophages are activated. So when macrophages are activated, all kinds of biochemical, neurological responses occur in the animal, and all these things lead to variables in the research. Not to say discomfort and animal welfare issues. Contamination leads to changes in cytokines and B cells, which again affects the entire immune system, which affects the well-being of the animal, the physiology of the animal. And subclinical infections are those that you may not see, which in this investigator himself may have not even looked or seen them because they're subclinical, but subclinical infections do exist, and they can produce profound physiological changes in the animal, and therefore leads to variables in the research. So in this experiment by John Bradfield from IACUCs International, hello John, if you're watching this, I'll say hi to you, that they infected these animals, rats, with Staph aureus and Pseudomonas aeruginosa. And they observed no clinical signs in these animals. However, these same animals with no clinical signs, in other words, they only had subclinical infection, they saw significant alterations in fibrinogen and glucose and white blood cell counts, as well as histology scores. Lastly, the American College of Laboratory Animal Medicine position statement on rodent surgery states that aseptic technique is required for survival surgery. Notice that ACLAM does not differentiate between rodents and larger species, but aseptic surgery is required in animals, regardless of the species. Because animals can develop either gross or unapparent or subclinical surgery site infection that may affect research outcomes and affect animal welfare. So we're talking about not only animal welfare, but really the welfare, if you want to put it this way, of the data of the investigator. math is not always what it looks like. In theory, there's no difference between theory and practice, but in practice there is. So today, my goal is really to show you some very easy to apply, practical and convenient ways to apply aseptic rodent surgery. Now, can I say that I can absolutely keep my animals 100% contamination free? It's not possible. I don't think it is possible or even practical. But by applying these principles, I think even though I may not be applying in practice what I teach 100% theory, but I look for that, the implementation of everything that I can to improve my surgery results. So the goal is really not the total absence of microorganisms, because that's not realistic. The goal is to bring that contamination below threshold. In other words, to make it practical and to bring those levels as low as possible. It has been said that it takes, in a normal animal, it takes approximately 1 million infection particles per gram of tissue to overwhelm the immune system. So if we can bring these levels as far down as we can, I think we're going to do well. Of course, we're talking about a normal animal, but what about an immunocompromised animals? If you really need to follow aseptic technique with normal animals, how much more should you do it with immunes that are immune compromised? So the adage that says the solution to pollution is dilution plays very well here when it comes to aseptic rodent surgery. Again, we want to dilute the bug to the lowest possible levels without the expectation that there will be a total absence of microorganisms. It's not realistic. So today, there will be tips and many tips. So look at here this picture. Now you know Mitch from the introduction. Thank you again, Mitch, for the nice introduction. What's wrong? Just think about this. What's wrong with this picture? Okay, think about it, look at it. You see this is a surgery table right there. What is he doing at the surgery table? He's clipping the animal. Where does hair go when you clip? It sort of spreads, it becomes airborne, the dander becomes airborne, infectious particles and all that. And what does gravity do? Whatever it goes up, it goes down too, right? So we need to be very careful what we do, where we prep the animals. So we're gonna give this a bad face. Mitch, we have to improve on this, so, which Mitch did. Right here you can see that Mitch has moved away from the surgery table so he can clip the animals away from the surgery table. So he is counting on a separation in the lab to be able to minimize contamination right there where the surgery table is. And better yet, an improvement to this would even be if you could clip the animals and prep the animals away from the surgery table, or actually do it in another room. So we are going to give this a smiley face. Okay, so why don't we just look at this video, and we want to give you samples of the videos that we have produced that makes visualization of these principles very easy. This particular video, we're using press-and-seal, which I know that in some countries you may not find it. Hopefully you do. I remember when I went to do a presentation, a week-long presentation in Chile back in, I think it was 2014, and I was told that press-and-seal could not be found. The first grocery store that I went to, lo and behold, they have press-and-seal. You can compromise, you may be able to use other materials like cling wrap and saran wrap, but they don't have the stickiness that press-and-seal has. So let's move this video forward.
file. And we're back.
Okay, so the video did not play. So I would like to, at the end of the presentation, I have a link to all these videos. We've produced a number of videos, and we're going to keep producing these videos. I apologize, I don't know why they're not playing. But right here in this video, we were intending to show you a very easy method of draping the table. The entire table with present seal without having to use aseptic technique. Very easy. A lot of individuals, a lot of investigators will have a sterilized tiny surface of a towel, something like that, and they get all kinds of cross-contamination because they haven't extended the sterile field. So I'm going to go into the next slide. We have a total of five video. Hopefully the other ones will play. Right here in this picture, I would like you to think about what's wrong here. So this is a sterile side, and we have the non-sterile side. We typically like to, or many times we like to, really have a tape or some indicator where the sterile side of the table starts where it ends. So what's wrong with this picture? What's wrong with this? Okay, hopefully you all saw it. Look at these instruments that have crossed the sterile field from the sterile field into the non-sterile field. So we're going to give this devil face. What about this right here? Look, the sterile side is all on the left. Everything is there where it needs to be. We're going to give this a smiley face. Okay? Okay. So hopefully this video will play now, and we are going to show you here how to place sterile instruments and supplies in the sterile field without touching the sterile field, without cross-contamination. Hopefully this one will play. We'll give it a try. I'm sorry they're not playing. It's okay, but at least they will be available to you. Okay, so we'll go into the next slide, and we'll discuss the skin prep. So the skin prep was another area of a lot of frustration for a lot of people. I see a lot of investigators using the wrong solution, the wrong scrub. So let's just look at this. First of all, you're going to remove hair when you do a skin scrubbing in preparation for surgery. Typically, most people use chlorhexidine or povidone iodine scrub followed by 70% alcohol. So keep in mind that, look at this right here. We're talking about scrub, not solution. So let's go on the next point here. You're going to do the scrub followed by alcohol. You're going to do at least 2 more times. But then after those 3 applications, after your last alcohol application, you're going to paint the area with chlorhexidine or povidone iodine solution, not scrub. Why am I saying these things? I'm going to ask you, how many of you have ever made hamburger patties? I think the answer will be most of you have made some hamburger patties at some point in your life. So when you make hamburger patties, do you just to wash your hands, what do? Do you place your hands under the water faucet, hopefully that someday that grease will be removed from your hands? Obviously not. That's not what you do. You're going to use soap, exactly. Well, if I use chlorhexidine solution, which is really water soluble, if I use it as my scrubbing solution, only the chlorhexidine or povidone iodine solution, then I'm not going to be removing some of the grease and some of the oils and debris that are on the skin. It's better than nothing, of course. That's why you apply scrub to begin with. Scrub is really the detergent. It is a soap. So as in this Dr. Jones lab, the way they did the skin scrubbing was with a little pad once with povidone iodine solution. So we corrected that in that lab as well. Once you have done your last application, in other words, your chlorhexidine or povidone iodine solution, you allow that to dry on. You can probably put a colony of bacteria in a solution of betadine or chlorhexidine, and it may take, I don't know, maybe 5, 6, 7, I don't know how many hours it would take to really kill all the microorganisms. But you allow that same solution to dry on, and then there is the instant killing. So the secret here is you allow the solution before you make your incision, allow the solution to dry on the skin, because it is the combination of the chemical activity and desiccating activity that is so lethal to bacteria. Now, we have another video, which I don't think is going to play with, because it is hard to follow all these words. And the video will illustrate quite nicely the process that we just described here. Because a picture, in this case a video, is worth not 1,000, probably 1,000,000 words. So we don't think this is going to play, but I think we may have to go into the next slide. Again, we apologize for this. We're very disappointed it's not playing. But keep in mind here that when you do your scrubbing, you should go, as it will be described in the video, you go from the center and you work your way to the periphery. Many people will do the periphery, go back to the center, and they recontaminate the surgical field. So again, from the center to the periphery. We'll go into the next slide. So draping the animal. Every animal should be draped. In fact, remember the Dr. Jones story? The animal's individual was doing stereotaxis surgery and the head was not draped. Many investigators will say it is too inconvenient to drape the head. Well, I think it can be done. It can be done very easily. And it needs to be done in just about every surgical procedure. But what constitutes the ideal draping material? The ideal draping material should be one that adheres to skin, so it doesn't move around. That way you don't bring contamination from the periphery back to the center of the surgical field. It should be impermeable to moisture, because if you use something that is permeable as you drape a material, then when things get wet, there is wicking of bacteria from the periphery to the center, and we have potential contamination. It should be transparent. It happens that when you are, in most institutions, in particular institutions of higher education, but I've seen it also in industry, where you are the sole surgeon and you have absolutely no help. So you are the surgeon, you are the nurse, you are the anesthetist, and you are the gopher. And you need to be able to see the animal. You need to be able to monitor the animals, the respiration rate, the respiration character. You want to see the color of the skin, all those things. So the ideal draping material should be transparent, and also should trap body heat. Hypothermia is detrimental to the physiology of the animal, to the recovery of the animal, and this is for another discussion. I wish we had time to talk about the problems with hypothermia in the animals. All animals should be in a state of normothermia throughout surgery and the recovery period post-op, and they should be warmed up. The ideal draping material traps body heat. Let me give an example of a material that is, I've seen it. In fact, I'll admit it, early on, many years ago, I've used it as my draping material. It's a 4x4 gauze. Yeah, it's better than nothing, But look at this right here. The animal gets wet, and then there's wicking from the periphery because it's cotton material. And a lot of people will use these stocking nets. These stocking nets are rolls of cotton material that orthopedic surgeons or the doctor will put on your arm before he puts a cast on, so the cast doesn't adhere to your skin. It is a practical material that can be rolled, sterilized, autoclaved, and rolled over the animal to cover the animal completely. I've seen it used. I have used it in the past. I'll admit it, but it is a cotton material. We would like to discourage you from using it. So let's talk about press and seal. Okay? So again, press and seal is a grocery item and it's sterile. Now, you think, Marcel, you are out of your mind. How can you use a grocery item as a surgical drape? Well, let's look at it logically first. One is, see the piece of meat right there on the box? If you were to wrap a piece of meat or your hamburger or whatever it is that you're wrapping and you place it in your freezer or refrigerator, and if the press and seal is contaminated and then you get a gastroenteritis, do you think this company, Glad, would be in business today? I don't think so. So really by logic, the press and seal has to be a sterile material. But again, my IACUC would not accept that. I don't think any IACUC should accept it without any some proof, because this is not a veterinary item. And so what do? We have culture press and seal numerous times, and we continue to do it on a quarterly basis, just in case. But 100% of our cultures have come back negative with zero growth. So in addition, press and seal, it adheres to the skin because it has a sticky surface. It is impermeable to moisture. It's a plastic. It is transparent, that allows you to monitor the animal, and it traps body heat. In fact, I remember one time we were working with press and seal. In fact, not only that, we were producing some of these videos that unfortunately you are not able to see. And Mitch started to wrap press and seal a couple of layers around his leg, and he said, Marcel, try this to see how it traps heat. I remember I even did it myself. I wrapped the press and seal around my thigh, and I felt the heat getting hotter and hotter, my leg getting hotter. It's because it trapped heat. Now, you see this item on the left, which is I have used many times. That drape, I think it's a questionable drape, because first of all, in order to keep it in place, you have to use Babcock forceps of some type that pierce the skin. And there's a little bit of trauma on that, maybe not a whole lot. It is material that you can't see the animal, and I'm not sure it is impermeable. And really, I lost that ability to really look at this animal, look at the respiration, the rate, the character, to monitor the animal. So we go in favor of press and seal, not only as a drape, but as you will see, as a drape not only for the animal, you've already seen it, for the table to extend your sterile field, and other items which we will show you in a few minutes. Look at this picture. This is a great picture that I have received from Charles River. Give credit to them. Thank you, Charles River. And this animal right here is undergoing surgery on the neck right there, on the throat. It's a catheterization of the jugular vein, and that jugular vein is going to be tunneled under the skin and be brought out between the shoulder blades here. So if you only had one surface where the animal is draped, when you turn the animal around, you're going to have some contamination of some type. Well, the solution here would be to place the press and seal, sticky sides facing each other, facing the animal, and when you turn the animal, lo and behold, you have maintained the sterility, and you have avoided cross-contamination. Would like to bring your attention to the tail. The tail should always be incorporated as much as possible. and on the drape, and the particular the plastic drape, and also it should be laying on, and then you'll see that in a picture in a few moments. It should be incorporated into the heating pad because the tail is where rodents lose a lot of heat. And if you keep the animal from losing heat through the tail, you're really doing a lot to maintain the animal normothermic. Right here is another picture. Look at it, everything is in place on the sterile field. Look at the tail is incorporated into the heat pad, which is underneath the animal, and it's under the present seal. So we'll give this a smiley face. There you go. Unfortunately, we won't be able to play this video, and we again will point you to our website where you'll be able to visualize all these videos. You can they're YouTube videos, and you can slow them down, you can pause and look at them. And I'm going to go into the next slide. So here's Mitch, okay? You know, these things, some of these things that we're going to be looking at now, they're quite obvious, okay? It is pretty obvious what's wrong here. However, all these slides I'm going to present to you, although it may seem obvious to you, it's what we see in these animal facilities and with these investigators in particular. So what's wrong with this picture, with this image? I think you know it. Okay, he did not use any hair cover. Okay, he is likely to have particles to fall right on the surgical field and contaminate the wound. So we're going to give this one a double face. What's wrong with this picture? Again, it may be obvious to you, but I see it all the time with our investigators. Look at that. Okay, so you know what the problem is? He's not using a gown or a lab coat. Okay, so we'll continue into the next one. You already know, here's the label, it says it has no face mask. Again, I see this repeatedly, and I go train at other institutions. I don't only see at my institutions, I see at other institutions. And these are all the things, and along with my experience with Dr. Jones, and actually Mitch was involved in that experience too, that has led us to improve our rodent surgery training program. I went to University of Wisconsin at Madison. Thank you, John, at University of Wisconsin, for helping me out further the training program, which is fantastic. We made a number of videos to illustrate these things, and not only just for my investigators, but because I was so frustrated at the lack of materials out there on the internet on the performance of rodent survival surgery in an aseptic manner, that we posted all these videos and handouts, numerous handouts, to our website that's available to the public all over the world. So you're welcome to any of them, anytime. So what's wrong here? You already can see it. He's using nitrile gloves, and we'll give him a double. Gloves should be sterile. You should use sterile surgical gloves unless you can confirm that you can sterilize or have used non-surgical gloves that are sterile. So why don't we just do a quick little practice? I'm going to give you a few minutes. Okay, so what we're going to do is there are many devils on this picture. Look at them. There are about 10 devils that I can at least identify. You might be able to identify more than that. Let me give you about a minute of silence and let you look through it. Identify, look at the person, look at the table, items on the table. Look to see areas where contamination, cross-contamination has happened, or that we have contaminated the sterile field or the sterile surgical table. I'll wait for a minute. Okay, are you seeing them? Okay, well, why don't we just identify them? I'll give you just a couple more seconds to look at it, and then we're going to go ahead and look at them. Okay, so number one, obviously, Lori's not wearing hair cover of any kind. Look at what she's doing. This is what I saw in that lab, Dr. Jones. She's touching her contaminated glasses with her gloves, and I saw that repeatedly during the surgery. And by the way, this investigator also claimed that he had an excellent surgery program, yet these are the results of some of those things that I saw. And she's using sterile gloves. Look, can you see right there, number 4, there's a syringe package. Syringe packages are not sterile. The inside of the package might be sterile, but the package is not. Look at the tube of ophthalmic ointment. There's contamination there again. Look at here, number 6, the suture package. Again, the internal parts, the inside of this pack, or suture pack, is sterile, but not the outer package. Look at the anesthesia hose and the animal, no drape on them. The sterile glove outer package, can you see that? Again, the gloves, the internal contents of this package may be sterile or should be sterile. The outer package is not. You see that red top tube right there, unsterile. And lastly, see that disinfectant bottle on number 10 on the sterile field. So very, very clear, right? Very logic. Anybody could have figured this out, right? Again, this is what I see all the time. Not only in my institutions, other institutions who are perform training. And that's, again, major reason why our program has been restructured, of training has been restructured, and why we have posted all these presentations, these handouts, PowerPoints, Word documents, and in particular videos on our website for our use and your use. So right here, look at these, you're supposed to wear a gown of some type. But in addition to that, even though the guide for the care and use of animals does not require the wearing of sleeves, plastic sleeves, we think they should be sprayed with disinfectant. In fact, there are some disinfectant out there that claim that they are sterilants. And why do we do that? Okay, it will become obvious in just a minute. And we'll go over that in just a minute again. Again, this is a video on how to properly don sterile gloves. We'll leave that for the near future when you can go into our website. So what is the required personal protective equipment for an individual who's doing rodent survival surgery? One, he should be wearing a gown, a lab coat, sterile gloves, a face mask, a hair cover. And even though, again, the arm sleeves are not mentioned in the guide, we believe they should be required and they should be disinfected. Why do I say that? It's because, look at this right here. Mitch, and you see that in another picture, Mitch is not just working here, but he moves his, not working right there, but he's moving his arms back and forth. He'll be moving his arms to pick up materials here. He'll be moving his arms back and forth all over the place. And in the process of doing that, the sleeves of his lab coat, if he didn't have, at least minimize the contamination by using these very inexpensive plastic sleeves sprayed with disinfectant or sterilant, then he's less likely to contaminate the field. So again, the solo surgeon. Once again, the same person, in particular, when it comes to rodent surgery, serves as the rodent surgeon, the anesthetist, surgical technician, scrub nurse, and the gopher. This is a problem because cross-contamination is rampant in these scenarios. So what happens if you are the solo surgeon and you have to manipulate the knobs of the stereotaxic apparatus or the anesthesia dials or something like that during surgery, there you go. Now you're using, you have to make those adjustments and you have sterile gloves. So the next slides provide solutions for the solo surgeon. Look at this right here. What is Mitch doing? Okay, he has sterile gloves and he's touching the, on the left, he's touching the dial to the oxygen flow, and he is touching the anesthesia, the vaporizer, isoflurane vaporizer. He has to adjust to deepen the animal, to lighten the animal with sterile gloves. That's a problem. So why don't we just use either press and seal or aluminum sterilized autoclave aluminum foil. Now, you notice I said press and seal and then use the word sterilized aluminum foil. The reason I say sterilized or autoclave aluminum foil is because press and seal, we have already proven that it comes sterile. And there's only one press and seal that I'm aware of. Aluminum foil, there are a number, although I pretty much would think, I can almost assure you that every aluminum foil sold in the supermarket or the grocery store out there comes sterile, but I cannot prove it. Because for us to prove it, we would have to stick to one brand and test that over and over and over again, so we can prove to our IACUC that that particular brand is sterile. But there are many brands, so which one do you use? Well, it happens that we are about to start purchasing a particular brand that we will be using that brand and the brand alone, and we're going to test it. So stay tuned for the future. So lots of smiley faces. What about stereotaxic apparatus? Any of you who does stereotaxic surgery knows that you're constantly during surgery, you're moving the knobs, you're adjusting to the right, to the left. You have to, if you're going to be going in the brain, you have to, if you have an electrode, the electrode, it has to be taken to a certain depth, and you have to do that adjustment and move the knobs and all that. So if you're using sterile gloves, guess what? You just contaminated your gloves. But why not put press and seal or aluminum foil, autoclaved again, aluminum foil, on these knobs and avoid cross-contamination. By the way, I need to say something about press and seal. After repeat applications of press and seal, because it has a sticky surface, a lot of times you're going to feel that there's a sticky residue on the surfaces where you have placed, like particular knobs and things like that, where you place the press and seal. Well, that can easily be removed with 4x4 gauze and alcohol. So smiley faces here. What about the light? Many times I need to adjust the light, the position of the light, because my hands on the surgical wound may cast a shadow on the wound. So I need to move the light to continue to visualize my sterile field or my surgical wound. So again, here you have some solutions, practical solutions. And then the microscope. This is our microscope, surgical microscope at work. The same thing we do with either press and seal or aluminum foil. And this is, I was evaluating the surgical program. An investigator was having infections at another institution that I will not say where. And even we have to go over all these issues of press and seal, how to maintain sterility. They were not using sterile field, they were not draping the animal. So after we went through this training, I go back to the lab to see how they were doing. So they were using, in this case, saran wrap or cling wrap, press and seal. I saw this and I was very impressed because this particular surgeon had to do timed injections. And as such, she needed a timer. Now, if you touch the timer, guess what? You're going to contaminate your gloves. But she was very creative. Look what she did. She just covered her iPhone and Very easy solution. The same way, the same individual used cling wrap to wrap the pen because she had to write notes and results of her findings during surgery. So how easy was this? Again, I apologize. I wish you could have seen the videos, but you will have access to them. Can you now identify common mistakes that lead to breaks in aseptic technique? I think you do now. Do you now have easy to apply skills? And you will be able to, I believe. Do you now have the new tools to improve your programs, in particular if you do training to improve your program's aseptic technique? I think you do. So here, finishing up, I'm going to refer you to our website. Here's on top a short URL, and on bottom there are long URL. Go there. We have lots and lots of material. But before we do that, this is where those links will lead you to. And this page goes down and down because we have all kinds of materials here for you on rodent surgery anesthesia, on biomethodologies, techniques in mice and rats. We have actually even handouts on surgery, how to diagnose breathing problems. And we have all the videos that I've been mentioning here, and you can see them here, and we will continue to populate this site with more videos. And these handouts are updated as new information comes up. So use it to your advantage. We even have guidance here. And if you're doing a particular surgical technique, if it produces mild, moderate, or severe pain, well, we give you suggestions on the type of analgesia protocol that you should use on these animals. So thank you very much for attending this, and we welcome your questions.
So thank you, Dr. Perret, for your presentation. And a quick reminder to our audience on how to submit questions. Simply type them in the Q&A box found by clicking on the green Q&A button at the lower left of the presentation window. And Marcel will answer as many questions as the time permits. So let me go back in here and start pulling some up. We've had quite a bit. Again, sorry for the technical difficulties. We apologize for that. So let's get started here. So the first one I saved was, let me go right here. It's actually the very top. Okay, so the first question I have here is from Linda Walla Zix. Apologize if I butchered your name, but she's from Wayne State University. The question is, are there any abstracts available which speaks to the use of press and seal as a surgical drape?
We actually published last year a very short little technical advice paper in Surgery Savvy. I'll be glad to send this to you for anyone who requests it.
Thank you. The next question is from Ulysses Orchard from Rice University. The question is, I know you have advocated the use of press and seal in the past, but I have concerns that it advocates the use by other veterinarians. Due to the high volume of surgery, is it still a good drape to use?
If you're talking about private practice, I don't know if you're talking about private practice or not, but I have had private practitioners have contacted me asking me about it. I said, go for it. You can get repeat overlapping, and I wish, again, you could have seen the video where we do that on the table, but you can see overlapping sheets. You can actually apply overlapping sheets of press and seal and use it as a very inexpensive and effective drape for your animals. Not sure if I answered that. Is that what you understood too?
Correct.
Mitch? Okay.
And also, I just want to remind y'all that all these videos we're talking about, the links he showed y'all can go there and access those. The next question is from Trish Lindsay from the University of Calgary. The question is, when using press and seal, I presume it will be placed with sterile gloves. How can it be placed sterilely, and how would you recommend to re-glove once drape has been placed?
Let me refer you to our videos where we illustrate that. There is a method of doing this in a non-sterile way, and you'll be surprised. again, it was one of the videos we intended to present today, but you can watch them online through our website. And also, we show you how to do it with sterile gloves as well.
And in the same, another question from Andrew Blickman from Indiana University School of Medicine. He asked, can the surgeon grasp the perret-gentil from the container if he doesn't touch the container and pull it out with his sterile gloves, and then can those gloves still be considered sterile?
You can pull it, yes. I will refer you again to our videos. That is well illustrated in our videos.
So we have two techniques that we show in videos. There's an assisted way to pull out the perret-gentil and keep your sterility, and also we have a way where you can do it as a solo surgeon. Next question is from Lisa Wilberforce, hopefully I said that correctly, from Queen's University. The question is, how would you use perret-gentil for stereotactic surgery?
Once again, we have illustrations. We have one handout in our website where it shows you how to do this in a very practical manner. Please go to our handouts. This question is addressed on, I believe the title of the presentation is using perret-gentil or something like that for stereotactic surgery.
And just to reiterate, because a lot of these questions could be answered with the videos, the information that we share with you about our contact information, we're always happy to answer questions and to help you guide through things. So if you're having problems with the videos, just email us and we'll get back to you and we'll figure it out.
Yeah, you can actually email Mitch as well, but I don't think I gave you his information, but you can email me, and between the two of us, we can answer a lot of your questions.
There's a couple of questions, and I'm going to kind of tie them all together. Is asking, if your animal is on a heating pad, does the perret-gentil interfere with keeping the animal warm?
Actually, it helps maintaining the animal warm because remember what we talked about earlier in the presentation, perret-gentil being a plastic material, it's almost like a windbreaker. When you wear a windbreaker, it traps the heat, and it helps maintain normothermia.
And so to go with that, another individual asked, is there any chance that the animal would overheat with the perret-gentil on a heating pad?
We advocate always to maintain the animal's normothermic, but keep track of temperature. You should have a thermometer. There are systems out there that use systems that give you feedback, and you should be able to see it on a monitor. Yeah, you should keep track of the temperature. You should be able to maintain normothermia. And these systems out there, for example, Ken Scientific's systems, like the Physio Suite, they give you feedback, and when the temperature goes high, the homeothermic blanket pad turns off, and if the temperature goes down, the homeothermic pad goes up. So yes, it maintains normothermia, exactly. You should monitor temperature.
Thank you, sir. And another question is, this is more about surgeries and instruments. The question is from Bruna. Of course, I picked the hard one to pronounce. Bruna Mora Cuddy from McGill University. The question was, I noticed that many researchers are placing instruments in 70% alcohol during and between multiple surgeries. What are your thoughts on this practice?
Well, we have in one of our PowerPoint presentations, we discuss this in quite a bit of detail, and alcohol itself is not considered a sterilant. Prolonged use of it, maybe, but a lax position on the use of alcohol is that it should not be considered a sterilant. But if you initially autoclave your instruments and then you place your instrument between surgeries and alcohol, and you use a hot bead sterilizer in between to sterilize the tips of your instruments, we recommend that. We think that's okay. We limit this to the instruments to up to 5 surgeries with an initially autoclaved set of instruments, because beyond that, and there's a publication out there that has shown beyond that, the microbial burden goes up significantly.
Thank you, sir. And it looks like we're out of time. I wanted to thank the audience for joining us today and for all the interesting questions, very good questions. For the questions we don't have time for, we'll address these with the speaker via contact information that we've provided in this presentation. And with that, would you like to say farewell?
Thank you very much, everyone, where you may be in the world. We're pleased and honored that you attended this session. I hope you found it helpful. Again, contact me anytime. I'm available. And if I don't respond right away, I will respond eventually.
And one more point to let y'all know is that we're going to push out the videos that did not work earlier to y'all after this. So that wraps it up from here in San Antonio. Thank you, everybody.
Thank you.
Just gonna hear the word, make sure that